It's my pleasure to welcome everybody to the fourth International Conference on Pluralistic Counselling and Psychotherapy 2021. So a warm welcome, everybody, to what's going to be a really excellent event, I'm sure. I think I've suddenly put on my sensible voice after we've had a half an hour of kind of hanging out and just having fun with each other. But I guess I'll just do a couple of things by way of intro and housekeeping, and then I'm going to hand over to Andrew, who's going to do some more introductions. I don't think there's much to say for tonight. I think we're here for a few hours together. We've got about an hour of panel discussion coming up, so we're all going to stay here in the main room together. And as the panel start to talk, most of the way that we've got available to us to communicate as a group is going to be in the chat room. So it's been lovely kind of warming our fingers up for that and using the chat room. So if anybody's just arriving and wants to use the chat room to say hello, you're very welcome to do that. And then I think as the panel goes on, we'll also be opening up for questions and comments from the group as well. And then we'll move towards our kind of more social time towards the end of the evening, but maybe Andrew will say more about that in a few minutes. We always just like to say around the chat room, it can move really, really fast. So just to, as we go through the next day and a half, I guess just to be mindful of how we all are together and bring those kind of values and qualities that we like to have in our work also to the chat room too, so that we can hold it as a space that feels containing and warm, but also, you know, we want to keep our challenge, we want to keep our authenticity, but take good care of each other too. And maybe just a little note on confidentiality. We are asking colleagues not to save the chat room as well, as that's so that we can all just talk and type freely, I guess. We are gathering up resources through the conference, PowerPoints, references, we're recording, as you can see as well. So all that good stuff is going to be made available when we get to the end of the conference. So you don't have to worry about missing anything, but that just kind of keeps that as an open and free space. We've got, I think, a little bit more to say tomorrow morning because we've got encounter groups, we've got breakout rooms, and we've got panels. And so maybe I'll say more about how all that kind of tech will work in the morning, but that's just a couple of things for me to get started. I also want to say hello to Erwin and Sebastian, who are also with us from the team from online events. So with plenty of tech back up in the room. So thanks guys for being here with us tonight. If you've got any tech issues going on at all, please just give us a shout in the chat room and we'll be right there to give you some support. I think that might be enough for me. How about you, Andrew? What else might you want to add in terms of introductions and saying hello?
Okay, thanks for that, John. So hello, everybody. So I'm Andrew, as it says on my little screen. Again, from me, it's a welcome, and I hope the first half hour hasn't frightened you all off, and that you're going to get something really useful out of this evening and tomorrow. There's just a few quick things I wanted to say. So I wanted to move on to the panel because I think that's probably what you've come for this evening. I mean, first I want to say thanks to John and this whole team at Online Events, because these we've all been to meetings and conferences where the technology hasn't worked very well, and you know, we might still get our glitches, but we have a fantastic team with all the people from Online Events working to make this happen. So thanks to everyone for that. And I also want to say that we're co-hosting this with the University of South Wales, which we're absolutely delighted to be doing. They're doing some great work around pluralism, and I know Anna and Mike will say more tomorrow at the start of the conference, but there's been a small conference committee, so thanks to all the people who've been involved in that, but Anna and Mike particularly have worked incredibly hard to pull things together in a way that we hopefully is going to be of value to you, because we know this conference, there will be people here who identify very strongly as working pluralistically and sitting within pluralistic frame, or people who are training from a pluralistic model. perhaps lots of people who are inquisitive or interested and wanting to find out more and how it does or doesn't relate to their practice. So it's great to have everybody here. And a little plug as well. I mean, the whole philosophy of pluralism is about inclusivity and collaboration, and people playing their part in making this happen. And I guess I'm doing this opening today because I took over recently from Kate Smith, who has been facilitating what we call the steering group, which is a group of people who've been meeting together to kind of keep the momentum going, really, and come up with ideas about where we take pluralism forward. And Kate's done a sterling work for 3 years, and I've taken over for the next year. And I suppose what I wanted to say is we're really keen for people to get involved in the steering group or in any of the other groups. You'll find out more about them tomorrow, because pluralism belongs to all of us, and we're absolutely not kind of holding this to a central group of people who are in control. So if you want to find out more about the steering group or indeed any of the other groups, or if you want to get involved and you want to come along to one of the meetings, you would be very, very welcome. So probably at the end of tomorrow, I'll give you my email address and you can drop me a line, and we can hopefully kind of get involved. So it was a pitch to not only engage in the conference this evening and tomorrow, but in the whole future direction of pluralistic practice in the UK and beyond, because this isn't just a UK endeavour, as we know. So what we thought we'd do this evening, which is what we're going to move on to now, I'm not going to go through introducing all the panel members because I'm going to ask them to do that, but we have Mari, Mick, Maria, Richard and Anna. And they all come with their own different perspectives and different ideas. And so I'm going to ask each one in turn is to just briefly introduce themselves, just say a little bit about kind of who they are and what they do. And then just to offer some reflections really about kind of where we've come from over the last kind of 10 years of pluralism since Mick and John's kind of early work that began this momentum. Where have we come from and what have we learned? But less just retrospective, more about looking forward. And I'm inviting the panel to not only think about where does pluralism go in terms of the provision of therapy, as we all understand it, but are there other things that a pluralistic position might be able to afford us? As we all are very aware, we're in a time of trauma, a time of change. The pandemic continues to affect people all across the world. We're also in a position where, quite rightly, principles of social justice, inclusivity, decolonizing kind of ideas around therapy and mental health are very much at the fore. And it might be pluralism has some role to play in enabling us to do that, or it may be not. So I'll ask each panel member in turn to say some thoughts, their own ideas, and then what I'll do is ask you to put your comments or questions in the chat, which hopefully John and I will keep an eye on. But also, some of you might want to say it rather than write it. And if you do, can you raise your hand using the reactions button at the bottom of your screen? There's a raise hand option there. So if you raise your hand, we'll come to you. But equally, I know not everyone likes talking on Zoom. So a promise to you, if you put a question or a comment in the chat, I'm not then going to come and ask you to speak to it, because some people just like to ask but not talk on the actual event itself. So don't feel as if by putting something in the chat you're then exposing yourself to something you didn't want. But of course, you'd be more than welcome to unmute and come in and have the discussion. And equally, we're not looking for the next kind of 50 minutes to an hour maybe to be a kind of love fest of pluralistic practice, where this will develop, our ideas will develop through challenge as well, and keeping in mind John's comments about kind of us being able to do that respectively and supportively. But where are we falling short, or where are there kind of inherent problems in what we're doing that we might need to address? So we're as much open for challenge and thought and reflection as we are for ideas about where we go. So I'm going to go through the list just as I have it now, through no order of priority beyond. So I'm just going to go through the list as it appears in front of me now, through no order of priority. I'm going to ask Mari if you could come on, say very briefly kind of who you are and what you do, and your thoughts. Where have we come from, and where might we be going, and what do we need to think about?
Wow. Okay. Well, first of all, I'm Mary Thurston, and I'm a senior lecturer in counselling at Abertay University, and I lead the MSc counselling programme there. And I'm actually been looking at the arrival list, and I'm just so heartwarmed to see so many of our Abertay past, present, and some future students. I recognise some of the names of recent applicants who've just been accepted. So a really warm welcome to you all. You know, they're from all over. They're like especially from India. They're like we're just like there's so many here, and yeah, very warm welcome. And also realizing we have I don't know if you have this in your counselling training, we call it creeping death, and I've actually realized today how that feels, just that notion of like you're going to start and you're going to ask us to introduce ourselves. So the creeping death I have experienced again, and realized how nerve-wracking this is. So I am a bit rambling, I'm sorry. So do you want me to, Andrew, do you want me to say a bit about pluralism? Did you say about where I am and what my...
Yeah, I suppose, I mean, you've been involved in kind of developing pluralism right from the get-go, Mari, and you know, like your work at Abertay, and I know you individually have done an awful lot as well, and kind of your brief reflections on that kind of journey we've been through, but more importantly, where do we go next, given where therapy is and mental health is, and where all of that sits in the context of quite challenging times in our society.
Yeah, well, actually, I remember really clearly. Like, I mean, I trained at Abertay just at the point where John and Mick were kind of really finalizing their ideas about pluralistic practice, what it might look like, and there was still a bit of kind of openness in that as well. And I remember, like, this was my second career, and my first career had been in education, and latterly in that I worked with additional support needs. And so in that there was like personalized learning plans for the children who need it, depending on what they want. They were tailored to the child. So when I heard of pluralism, it made complete sense that we would tailor the therapy to the client, the needs of the client. So right from the get-go, I really understood it and kind of thought, you know, this is a great principle, and I'm really happy to be training in this. So in terms of where I see the future of it, one of the most exciting things I think about pluralism is the potential to kind of unite our profession. I mean, I think, and I've said this before in a wee chat with Kate, like one of the things that we've not done well is we've kind of been siloed. You know, we don't have a united profession like teaching or like medicine or social work. We're kind of all in our tribes, and I think we've not as a whole, as one voice, kind of said, you know, counselling works. And I think the thing about pluralism, there's so much respect and honouring of all the approaches that it feels like this could be something that could unite us going forward and help us forge the career. So I think for me, I see it as, yeah, as something that has got a lot of potential in terms of us developing our profession.
Thanks, Mari. And just a quick follow-up question for you. I mean, is your sense that the profession is still split or still has fractures in it that need uniting?
Well, I think probably it is. I think you know, it's maybe getting better, but in some ways I feel it's more entrenched than ever, you know, in terms of when there's a kind of chance of collaboration, sometimes people retreat back into a position of security. And I don't know, my sense is it's not a done deal that we all want to collaborate. Maybe it is, maybe I've got that wrong, and I'm really open to hear how people are thinking about this. But I do think, you know, we need to unite. We need to start researching, you know, like in ways that are collaborative, and not trying to say we're better than this type, that approach is better than this one, you know, but to really start going, we are a counselling profession, and we come with many strands to it, you know, and we can we're effective. Maybe it's a bit too simplistic and naive, but that's the hope.
No, it's a great starting point, Mari. Thank you very, very much. And just to say, Joe, I noticed your question going through the chat, which I'll come back to once all the panel have spoken, and we'll use that maybe as a starting question. Mari, thanks very much for that. Mick, do you want to come in and say just a little bit about yourself and kind of your thoughts?
Yeah, I mean, maybe the first thought is just to say, I mean, it is amazing to have a conference around pluralism, and I'm so grateful for Anna and Mike and the people who put the conference together and everybody who's come here. When John and I were first thinking about some ideas back in the mid 2000s, I think the last thing we ever thought was anybody else. Well, last thing I thought, maybe John was smarter than I am, but was there anybody else who was going to be particularly interested in it? I think we were just, for me, it was about just trying to, I think, articulate something for myself about what felt important in therapy, and that it's kind of articulated something that other people resonate with. It's amazing, really, and it's been such a privilege to hear other voices. And I think you've been saying that, Andrew, and just to start off by kind of underscoring that, is so important for me. It's so important for me that pluralism doesn't become a kind of fixed thing, because that was the whole, in a sense, it's a critical perspective, it's a challenge, it's trying to stay fluid. And I think that means, of course, that has to be with pluralism itself. So I think there's very few rules, if you like, rules about what it means, and who is and who isn't. And I do hope we are really open to challenge. But I think for me, and I guess in a way, it's kind of, sometimes you write things or you develop things, and then your understanding of what you were trying to say kind of evolves and gets clearer as you go along. Sometimes you write stuff and you don't really know. And I think for me, what I've become clear about in the last few years, maybe, is that what is at the heart of pluralism is ethics and a social justice ethic, really. I think for me, that's what I was trying to articulate. And I think John as well came, I think to a large extent came from that background, and trying, for myself, coming from a person-centered standpoint, really trying to pull out what was important for me. But what was important for me was that commitment to the client's voice, to understanding and respecting, really valuing the client's place, and also about something about valuing different therapeutic approaches. Because why? Because it's something about, again, really, I think for me, that idea that there's lots of different ways isn't just about being integrative because that's effective. It's about respecting colleagues, but it's also about putting the client's voice first, in the sense of trying to put what clients might want before our own kind of, as Mari was saying, kind of schools or positions or perspectives. So, and I think, so when I'm thinking about where pluralism is going to go, and I agree with Mari, what's great about pluralism is I do feel it has potential, because it feels very open, and it does feel like an ethic and a way of thinking that then can be applied to, so we'll be talking at the conference about research, about pluralism in research. I think I'll be talking with Annie about encounter groups and the idea of how you might apply pluralism to encounter groups. There's a whole area, training. There's so many different areas in our field that we can think about in pluralism. But also, and then in terms of linking up with, as you were saying, Andrew, about kind of wider field, and particularly social justice. I mean, very recently, last week, for instance, we had the issue with the 3 Black England football players who missed penalties, and the racism that got voiced on the back of that. And it was really exciting, I think, at the conference last year to start talking more about diversity and what that means in terms of pluralism. And, pluralism doesn't have a monopoly on that by any stretch of the imagination, but it's lovely to feel that pluralism is aligned with supporting those voices and looking at these kinds of questions about how do we bring in issues like that, like those issues, right? How do we bring that in? And I think as a profession, though, I mean, the frustrating bit for me is I'm not sure how far we've got with that. There's been some writing on it, there's been some work on it, but in terms of really kind of innovative thinking around issues like race, class, difference, what that really means in terms of the profession. I think we've still got a long way to go, and certainly that's in my work at the moment and the stuff I'm working on. That's what I'm trying to do. So yeah, I hope from a pluralistic standpoint we're able to do that, and we're able to address those kinds of issues. And I know there's a difference in diversity group. Maybe Richard will say more about that, but that feels so gives so much potential. So I think pluralism, sometimes you write stuff and a few years later you think, well, I'm not really sure if that was right or what I was trying to say there. But I think with pluralism, I still love it. It's stuff that we developed started writing about 15 years ago, and I love it. And I love the kind of, what I love about it is I think the space that it opens up to bring in these issues and bring in difference and bring in diversity.
Brilliant. Covered a huge amount of really important stuff there, Mick, which I hope people are going to follow up with questions as well. And something about the potential is there, and in some ways we're working with it, but actually we need to be braver and push it much harder and do much more with that potential. Otherwise we're kind of wasting an opportunity, and the consequence of wasting an opportunity, it seems to me, isn't just about how this as a philosophical idea might kind of flounder a little bit, but actually it means that we're failing large groups of communities in our society who we could otherwise be finding different ways of speaking to. Thank you, Mick. Great, another great set of comments. Maria, would you like to come in and introduce yourself and share us with your thoughts?
Sure. Hello everybody. And yeah, my name is Maria, weirdly spelled Maria, that a lot of people have been calling different things. Maria with an extra one. I am a lecturer at the University of South Wales. I'm also a practitioner in private practice and a researcher. My research focuses on some of the things that Mick just very eloquently touched upon, researching difference diversity. In particular, I'm looking at lived experience of LGBT people in post-Soviet Central Asia. So very specific. So in many ways, that's not only my research, it's also a speciality of my practice. I work with marginalized groups, I work with LGBT people from post-socialist countries. And I suppose pluralism fits very well with that. For me, the idea of openness and working closely with clients, giving power to clients, empowering, and also keeping that sort of openness and critique open as well to the ways of working is particularly important for me. With regards to the challenge that I would like to, I suppose, address and bring forward, I feel the field has been developing very rapidly, and thinking, yeah, just 15 years ago, it's so young. it's such a young approach, yet it feels like it has already, I mean, the amount of people is a testimony, amount of people here is a testimony to how far it went, I suppose. However, what I'm struck by, and I was struck by thinking about this roundtable, is thinking about how do I articulate it to my non-Western clients? How do I articulate it to my Russian-speaking clients, for example, what I do? How popular is pluralism in my native language, in Russian, for example, with when I talk to other practitioners and trying to explain how I work. And I think one of the ways in which I would like to develop this approach is to think about how can we open a dialogue to diverse geographical locations. How can we bring this approach, being mindful of the power and power production, I suppose, hierarchies in place in academia as well, and being mindful of the place that we occupy, the fact that this approach has been developed in the global West, and the big research base is still set in the global West. So that is something that I'm grappling with already, and I would like to continue, I suppose, thinking about.
It's a really, really important challenge. The metaphor that came to me when you were talking, Maria, is that could we be running the risk of changing the wallpaper in the same house? So it looks different and it feels different, and we've redecorated it. But actually what we've not done is attended to any of the structural issues that have stopped people getting into the house in the first place, and whether indeed that's the right house. And something like you're saying, that is there a danger that what we do is still kind of predicated on the notion of kind of white Western ideas, not only around therapy, but around mental health and human experience? And how do we kind of shift that forward?
Yeah, absolutely. And indeed, academic knowledge production, discourses and hierarchies of knowledge.
Yeah, really, really interesting. Thank you, Maria. And second to last, but in waiting in line is Richard. Richard, do you want to come in and introduce yourself and share your thoughts?
Hi there, Andrew. Thanks very much for the invitation. I very much came to pluralism very much unknowingly. I came to one of these pluralistic conferences and thinking, this sounds a little bit like me. I was a newly qualified counsellor from York St John University, and I found myself resonating with all these theories and people and everything else that was around me. And suddenly pluralism became something that became very dear to me. As my practice developed, I embraced DBT training to diversify how I work as a practitioner and how, as a humanistic therapist, do I integrate a directive therapy based in this. Pluralism was something that allowed me to be able to do that without totally reorganizing who I was and how I wanted to practice. The other thing that I think is really important for me is that, as you can see, I practice from a hospital bed. My research looks at how it is for clients to work with someone that works from a power wheelchair or from a hospital bed. It is very different. There are many, many models out there of disability, many models of different intersections. I come from a Chinese background, I'm disabled, I'm non-binary, and I come from a first generation of people that never thought they'd ever come to university. There is something very beautiful in pluralism that allows a unification of people that would normally be in minorities. I'm very, very proud to work alongside the diversities group, which invites a safe space for people from all minorities, whether it be from the main race or disability or gender, to ones such as size and class and all the other ones that often don't mention. And I see that pluralism essentially is a opportunity in a place where unification can happen, not just through therapies, not just through research, but also embracing all our differences in a space where there is no one answer. And that's okay for there not to be one answer, but it's also okay for each individual that comes to bring their own answer.
It's an interesting point. It's an interesting point, Richard, about kind of my experience as well has been that kind of learning to live with the uncertainty and the not knowing, there not being an answer, and yet sometimes that can be incredibly difficult as well. And I wonder whether one of the criticisms that's made of pluralism that it's just another model peddling its wares, basically, and what you're all saying thus far, it's not. But I wonder going forward how we change that kind of cultural position around where we sit with a philosophical base in what we do.
Very much so. And I think another element that, to not just air my own voice, but other people of the voices of the diversity group, is allowing diversity and allowing pluralism into the roots of our profession, into the training, into those bodies in which often people from minorities don't always get that voice, and allow pluralism to be that vehicle for change, because change is required in the profession. The profession needs to continually change throughout its course to ensure that we meet the needs of the clients that we are there for. And I truly believe that pluralism is inviting to people from all backgrounds and all professions where some other models aren't able to, particularly of directive therapy such as DBT, which wouldn't fit seamlessly into another model.
Brilliant, Richard. Thank you very much.
You're welcome.
And last but absolutely not least is Anna. Anna, do you want to give us your thoughts?
There we go. Can you hear me?
Can, yeah.
Yeah, okay. So it's been really interesting listening to all of these points of views that have been put through. And I'd like to just come at it as a practitioner. sort of trained in CBT, but found myself moving towards pluralism. And actually, my previous career was in education, and specifically with children with disabilities, social disadvantage, and neurodiversity, and set up a centre in Oxfordshire for families with disabilities. But it was done, but back sort of 20 odd years ago, it was done from the perspective of the families. Because very often what we found was social services or local government would create a centre for families, thinking they knew what they needed without actually consulting with the families, and then they failed, or the funding was withdrawn or whatever, because they hadn't actually done that collaborative approach. And this centre was very much about the parents and the families being at the heart of this centre. And so that idea of collaboration and preference was already, I'd already got a sense of how that worked in my work with families with neurodivergence. And my practice is very much with clients with neurodivergence. And interestingly, that tension between giving them a voice, allowing them to have a preference and to collaborate is sometimes very, very difficult because they're so not used to it. And so I think sort of that's a challenge for us as practitioners when we're working with. I've also found that the same when working with clients, female clients, asylum seekers, is they often don't know how to have a voice, how to actually to do their preference. When we talk about a Western model, I found that to be very much something within my practice with asylum seekers. The other thing I wanted to sort of talk about is in terms of the future of pluralism through training, because my role at University of South Wales is as course lead for the BA in counselling and therapeutic practice, but I also work on the MSc and the postgraduate diploma. And we're very much, moving into the pluralistic approach. But what I find is in placements and with supervisors, there is not enough understanding there on what pluralism is. And so we've got our students who are very grounded in the theory and are in the training and everything, but they almost having to go and train other organizations and supervisors in what pluralism is. And I'm not sure that as a model that we're promoting ourselves enough out there in organizations, in governments, local governments, and in social services, in health, in mental health, about what the pluralistic practice approach is. And this causes tension sometimes with our students who can be left behind because someone doesn't know what pluralism is. And also we found that with supervisors, it can be really hard for our trainees to actually find pluralistic supervisors. And I think for us as a pluralistic community, one of the things for us to look at is how, do we encourage universities to provide pluralistic supervisor training, or do we as a pluralistic community create some CPD for existing supervisors that they can come and do 2 days and add on and offer pluralistic supervision, because it's a very different concept. And I'm aware that some of our students, and I say this, in trying to be as kind as possible, but have been held back in their practice because they've had a supervisor who's come at it from a single approach, and there's been a lot of tension then between their training and then the supervision. So I think that's something that we need to have a look at. The last thing that I'm trying to grapple with myself, and Richard and Maria both touched on this, is how we can get more diversity into the training programs in terms of our students. Because that dialogue of diversity, if we're talking about coming from the voice, we need them to be in our training programs. We need to have training programs that actually have way more diversity in terms of gender, race, religion, ability, all the rest of it. And how do we do that? And we're sort of thinking about going into colleges and sixth forms and engaging directly with the students about counselling as a career choice, and giving them that voice about, well, what would attract them into it? How would we tackle that and to make it a more diverse training body? Because I think for us, again, that voice needs to come from the students. If we're pluralistic training, we need to be pluralistic training, as in the voice of the students need to be part of that training. And it will be, the diversity will then happen more if our student body is more diverse, if that makes sense.
Yeah, it does. So there's a lot of challenges in that. And one of the themes that I heard was something around kind of true communication. So we can believe something, but how do we communicate that this is our position? And in that communication, how do we bring others in who wouldn't ordinarily come in? I don't mean into the kind of the pluralistic steering group kind of thing. I mean into the world of kind of being helped and being supported and being encouraged and being enabled to find kind of their solutions. So how do we reach communities who wouldn't ordinarily look at the kind of services that we offer, and how do we make the changes that we need to make? Because what you're saying is, in some ways, we could be impaired by the lack of structure externally which can support the development of our thinking, and we become kind of self-reinforcing in that way. That probably wasn't a very sophisticated summary of what you said, which was much cleverer than what I've just said, but that was really helpful, Anna. And there's lots of comments coming in. So I'm going to start with the question from Joe, because I said I was going to do that, and I would invite any of the panel members to come in and respond. But indeed, there's lots of comments coming through on the messages, and if you have something you want to say, by all means, put your hand up, and I'll try and bring you into the discussion as well. So the first question from Joe, I'll read it out in case you missed it. I'm curious how a pluralistic framework can be used to accommodate a Western medical model perspective and an indigenous, culturally informed spiritual belief system. For example, the two ways of seeing an approach to mental health and well-being. And I guess my interpretation of that, Joe, and by all means do come in as well, is something about how do we hold different positions that might in some ways appear to be competing or positioned very differently, but to do that in a way that they can sit alongside each other. So do panel unmute and speak, and I know we have some hands up as well. Mick, I think you were muted.
Yeah, it's a very interesting question. I just wanted to say a little bit about the medical model from from how I would think about pluralism. And I guess I say this as someone who's been very critical of the medical model for many years. But I think what I've seen, and we did some research about this, I'll talk about it in a sec, but essentially, I think for clients, patients, that medical model can be very helpful for some. And if pluralism is getting away from either or dichotomies about things being good or bad, which I think is really cool to it, and going back to what clients want, then I feel like we have to be open to a medical model perspective, that's going to be helpful for some people some of the time. And I think that's also respectful for our colleagues who hold medical model positions or see things in more diagnostic terms. So whilst holding open that there are other ways of seeing things, and that's not going to be right for all clients, I think that we shouldn't. For me, pluralism is not coming from a definitively anti-medical model perspective, and I guess that differentiates it from some maybe more other radical perspectives. We had a student at Roehampton who was doing some research, actually, she's just completing it, Neve O'Connor, developing a scale called a diagnostic impact scale, which asks clients to say something about if they've had a mental health diagnosis, what that experience has been like in terms of stigmatization, and did it help them access resources? Was it positive or not? And we found a real mixture. I mean, we found a lot of people saying, service users saying, they really actually valued having a diagnosis. And, that was a surprise to me. It maybe wasn't what I was hoping to see, but I think it's important to be open to that and to be open to that diversity.
Interesting. Anybody else on the panel?
Yeah, I would say that it is. I think I would agree with what Mick's saying. I think it's easy to accommodate both perspectives, and because I think there's not, and I think the medical model has a place. I know certainly when I had a period of depression after I was diagnosed with, I was going blind, I was told I was going blind, went into very deep depression. And I was very convinced that antidepressants would help me. And I think there are clients, we will have clients like that who come in and they really believe in a kind of medicalization of what they're feeling. But then I think as a therapist, it's like, I think as Mick said, there's a respectful positioning of, you know, what the client feels is going to help, as somebody who rejects it completely. And it is about indigenous methods of thing. And there's we're in the middle of writing a paper while John has you know, has kind of articulated it. There's a lot of group work into it, and one of the things he's done is had this example of pluralizing depression, and there's a whole kind of different ways of seeing it from different viewpoints. And I think that's the thing about pluralism, is that ability to hold all these viewpoints with, you know, lightly, in terms of, you know, what is important for the client. That's multiple truths. So yeah, that's.
Thanks, Mari.
I think for me, there's an element of exactly what Mick and Mari were saying. As a disabled person, often, as I've seen coming, pardon me, in the chat, to be able to access services, sometimes it's an absolute requirement to have a diagnosis. I also have to acknowledge my medical privilege of coming from a nursing background. However, there is an element of, I hear what Mick says about methodologies of difference, and maybe in the counselling profession, there is some anxiety or fear how we as counsellors slot in with a medical model diagnosis. For me, when I think about it pluralistically, sometimes disabled people need a diagnosis to be able to access the services, even get to be able to access counsellors. So for me, part of me thinks if I'm coming from a different modality or a different viewpoint, then often if these two theories seem like they collide, they don't in fact in the mind of the client. So in the mind of the client, it's beneficial for them to be able to have the diagnosis, and they seek the support from secondary modality. So if it works for the client, then why should it be a problem for us? Because at the end of the day, we work collaboratively and with co-production with our clients. So that's my way of thinking of it.
Brilliant. I'm going to move us on. I mean, it might be a comment on what we were already talking about or a new question, but Edward has had a hand up. Edward, did you want to unmute and? No.
Yes, sorry. I was having a hard time to unmute myself there.
Okay. Welcome, Edward. Hi.
Yes. First of all, I just want to be grateful for all the panels who were talking about student and the perspective of students and how important it is from, you know, to have students' views and things like that. But I also think that a good start would have to have those students, giving them a platform as well. And, you know, I was looking through the conference, and I didn't notice anyone speaking from a student perspective or someone who's currently, you know, training. So, you know, just to put things into perspective, you know, just being mindful of students, it's not enough if you don't, you know, actually empower those students and give them, you know, the voice and, you know, the opportunity to you know, to raise the current issues. And I think, you know, if you look at research, you know, like any sort of like programs, when you implement the service users, like, you know, from children perspective or from, you know, like substance abuse or anything like that, they have more chances of, you know, being successful. And I think the same would apply with students. You know, any sort of progress towards a pluralistic, you know, training for students would benefit if, you know, you actually include the students. So yeah.
Yeah. Anna, did you want to bring in any thoughts on that in relation to because I think it's a really good point, Edward.
Yes, it is. We actually have tomorrow morning. Mick and John are talking to some students and new practitioners about, you know, that their perspective of pluralism and where pluralism is going, because we were absolutely mindful of trying to get students involved. And when we took on the conference 2 odd years ago, and we thought we were going to be actually on campus, we very much wanted to be the student, to have the students very involved in part of what we were doing. And I absolutely take what you were saying, Edward, that it was very much part of what we wanted to do. But hey ho, here we are. And like so many things that have gone by the board this year, we had to just try and do what we could do. But yeah, I take on board what you're saying, and hopefully whoever does the conference next year and it's back on a campus, I really hope that students will be very much involved, because I agree, it's essential that they are.
Yeah, I think that's a really good point, Edward. Thank you very much for making it as well. And I think you make a broader point about, if we really want to change something, we don't do it to people, we do it with people. And I think that might be one of the things that is discussed in the research group tomorrow, because I think there's a pluralistic approach to research is also about doing research with rather than doing research to, and taking a very different frame. So this isn't, an expert-led position. This is about a mutual collaborative learning position. So I think you make a broad point, but also a really good specific challenge as well.
Can I,
Mick? Yeah.
Yeah, I just want to, just following up on what you're saying there, Angie, and what Edward's saying. It's complex, isn't it? Because it's a very valid challenge that Edward's making, and I absolutely agree with him. And yet, how do we make those kind of challenges in a way that really acknowledges and values that people are doing their best or trying to do their best? And I think that gets to the heart of, if we think about other debates there, you're kind of touching on, Andrew, about representation on counselling courses. Anna was saying about that, about having people from ethnic minorities, for instance, being underrepresented. How do we have a culture which can really challenge and really encourage maximum representation, but at the same time somehow, I don't know, values the trainers or whoever set stuff up that they didn't do that intentionally? There can be unconscious racism, of course, unconscious biases, but in a way that kind of values all of our humanity. And I think pluralism, going back to what I was saying before, sets a nice framework for trying to work that out. But I don't think we've got those answers yet. I think those are the kind of questions about how we deal with difference in a way that is respectful for all. It's tough, it's challenging, because we want to be, Edward's absolutely right, we want to be challenging on these things. But also we don't want to get into a kind of political correctness that makes people feel crap about who they are. That doesn't seem that well. I think from my experience, and those who are as old as I am will know that I think the kind of 80s, 90s political correctness of that's right, that's wrong, you can't say this word, you can say that word, something didn't work there. And I think for me, pluralism has some of its roots in kind of recognizing that kind of political kind of radicalness misses something, doesn't bring people with it.
Yeah.
Can I add on to this? I also am really aware that students, particularly the younger students, they're our future, they're our profession. They're the ones, they're the voices. I feel like, I'm 60 and on my way out now, and and there's young people, we're growing them, and it feels like we need to give them the right conditions, put them in the grow bags to make them really come to fruition, and they're the next generation, the next voices. So yeah, students are really important, and definitely to be valued.
And can I just add to that? I think we've got a lot of students attending, and we've also got quite a number of students who are presenting research as well, which is quite nice. And part of the reason for running the encounter groups was we've, as part of pluralistic steering groups, we've been thinking, how do we get students more involved? And one of them is to set up encounter groups, so they then take it and run with it themselves, in a real pluralistic way. So I think encouraging that is really important, Mari, I agree.
Can I joke? So I'm going to move us on. I feel like a bit like Fiona Bruce on Question Time. There's lots of things we could talk about, but I want to take just a quick question from the chat. I know Rolf's been waiting as well, but just before I do, can I just very gently and respectfully slightly disagree with you, Mari? And I don't think I've ever said that I want to disagree with you in my life before, so this is a first. But I totally agree with what you said about students being our future, and I totally agree with that. But I think we can also be too quick, and I absolutely am not talking about myself here, but I think we can be too quick around our older counsellors, and also the counsellors who've been in the profession a long time. And I think our culture is very dismissive of people once they get past a certain age, whatever that age might be. And I think that actually, to really move things forward, we need the energy and the challenge of the group, which is also sat alongside the kind of the wisdom and the experience of another group, and the pluralism perhaps is also an opportunity for that dialogue to take place as well. So you know, you might feel at 60 you're on your way out, but you won't go anywhere quickly. And I just think it's really easy to see that the future only exists within one particular dimension, and I think that actually we can hold it in right across the diversity of our profession, which includes age as well.
That is such a beautiful pluralistic response, Andrew. Wonderful. Both and.
Yeah. Excellent. I want to take a quick comment from Bill, who put a comment in the chat. Is the very description of pluralism as a model or approach already in danger of falling into the same trap as so many of these schools of therapy? And we've used those phrases already today.
Yeah, if I ever go on that, the word that I always liked, I think, is framework. Was John and I kind of use that on and off to begin with, and I still like that, thinking about a kind of pluralistic framework. I think that's one I find useful, but also one of the things we did in the first book, which I think still stands and is useful, is to distinguish between a kind of pluralistic perspective or philosophy of therapy versus a pluralistic practice, and to kind of recognize that they're linked. But the idea is that there's a kind of pluralistic outlook behind that. I mean, there's a pluralistic outlook on therapy. Behind that, there's pluralistic philosophy itself, which is a even broader set of principles. So yeah, I think pluralistic perspective or philosophy, and then pluralism as a practice in therapy, as a kind of being a pluralistic practitioner. Yeah, I think model, I definitely wouldn't use the term model. I don't think that sits for me very well with pluralism at all. Approach, yeah, I would kind of see that as kind of embracing both a perspective and a practice probably, but I don't think it's quite as specific as talking about a pluralistic philosophy or a pluralistic practice.
Mm-hmm. Any other thoughts before I move on? Okay, Rolf, you've been waiting patiently with your hand up.
Can you hear me?
We can, yeah.
Okay, great. No, it's just a comment on the medical model, and I agree that for me, part of pluralistic way of thinking is that I certainly have to work within a medical model when that fits the client. So that's not my problem with the medical model, but what's happening in my country is that the medical model is being made into the only model that we're allowed to use. The government has developed these patient pathways. So for every diagnosis, you will have to start with an assessment, and you have to document that you've done the assessment, and you have certain numbers of sessions for the assessment. Then the diagnostic part comes, and you're to choose a evidence-based method, which means a method that's run through an RCT. And that's, for me, a really delimiting way how to delimit diversity. And it's very easy within that perspective to start to explain those clients who doesn't follow the medical model, that they lack motivations and all these kinds of things, that we use a theory to explain why the client doesn't change. So my problem with the medical model is the political position it's gotten in our system. And that means that I have to do two things. I have to accept working within a medical model with clients who, and I mean, I'm trained in the medical model, so it's not a problem to work with a client within a medical model. But when it comes to all the other clients that doesn't fit the medical model, I have to break rules. So I have to train myself in how to break rules and not getting caught, which is an interesting way of living your life as a psychotherapist and counselor, that you write the medical journal in a way that never lies, but it's not quite true either. So you have to do all these strategies to sort of live in the system. What's happening in Norway is that our mental health service is basically divided in two. You have a specialist health service, which more and more works within the medical model, and those who doesn't fit ends up in the municipality, which now in the last 20 years in Norway has turned into a treatment level. It didn't used to be a treatment level. So my hope is that it might be that we have a specialist health service that we've lost to the medical model, and you only work with the medical model within that. So the fight now is to allow diversity of models within the municipality healthcare service. That means that the municipality healthcare service is another type of specialist service where you are, I don't have the English word for, but you're a sort of a generalist. But politically, we need to show that there is no evidence for the medical model, as I understand it. So it's a bad choice to make it into the only choice, as I see it. But at the same time, I mean, there is beautiful ways of using the medical model to work with clients who are really feeling helped by that model and having a diagnosis and relating to that diagnosis. Yeah, so that's the thought I had.
Thank you, Rolf. I mean, firstly, there's enormous interest in your new book, which is going to be How to Break the Rules and Not Get Caught. So we'll do a 20% discount on that next year when you've written and published that. I think that there's a lot of discussion as well about, I mean, we've kind of talked about medical model as to how it's experienced at an individual level, you know, and how we do work and don't work and kind of honour an individual's experience, whether that be within a medical frame or a social frame or a cultural frame, however that's brought. I suppose are some of the challenges of the medical model, of which I've spent many years working in, and my previous job was detaining people under the Mental Health Act. So, you know, I was strongly immersed in the medical model, even though I didn't always believe in what I was doing. It's one of the challenges, of course, that it creates a culture whereby there's a dominance of a worldview. The only way in which we can attend to people's distress is through a particular lens, and that's a very dominant lens, and it's a lens that leads to decision making around funding for research, for provision of services, and for structure of services. So thinking about if you live in a region, and there's been quite a bit of chat around IAPT. So if you live in a region where IAPT is a one way of delivering the psychological therapy service, would pluralism ever get a foothold within an IAPT service? Not because it wouldn't work in an IAPT service, but because it would be viewed as incompatible ultimately, because it doesn't fit quite. It's a square peg in a round hole. Mick?
I mean, I had the experience of working in IAPT in the kind of organisational level for a number of years. And I guess in terms of dichotomies, again, before I went in there, I was very critical of IAPT and questioning, but I found that really changed because of for nothing really more than just seeing the dedication, the commitment of the people working in there, and these were the people who were kind of setting up and making the decisions about what therapies. They were just so phenomenally committed, and I just developed enormous respect for them and what they were doing. I think on your question, I think pluralism could get into IAPT. I don't think there's any issues with the approach. I think what you'd need to do is that you'd need to choose a particular client group, like say clients with depression or clients with anxiety. You'd need to find some way of manualizing the pluralistic therapy, which I think is possible. But if you were to develop a set of maybe methods that could be used with different clients, different times, and some strategies for how you decided what you were going to do with whom, you need to have some way of checking adherence, and that's what your therapists are actually doing, which I know Kate Smith has been doing a lot of work on. You then need to probably pilot it and then do some, which we kind of done a little bit of, and it seemed to do okay. You need to do a randomized controlled trial, ideally from a couple of independent groups, comparing it against probably the best standard now, which is CBT. You probably couldn't do it against the control. But if you were choosing a particular thing that hadn't been very well tested to date, you could possibly do it against some kind of more inert control. And if you had a couple of studies showing that this particular form of collaborative integrative practice brought about change and you could train people up in it, I don't think IAPT would have a problem with it at all. You know, so I don't think it's pluralism per se or anything to do with that. I think it's just simply somebody would need to do those studies to show that it was effective and cost effective
I just wanted to check before I come to the rest of the panel. Jill, you had your hand up and it's gone. It might be you've changed your mind. But if you wanted to come in, by all means do so. Jill Brennan.
Actually, I think Mick has just answered it. I was going to ask, because I work in IAPS and have done for a while, and it does my head in. And it would be really, really nice. I have this fantasy of a future in which a pluralist approach is actually the approach that most people there take. I rather suspect that it's more prevalent than people actually admit. And I think there's an awful lot of translation into IAPS speak going on, but actually having that evidence base in a form that would be understandable by NICE would be lovely. So please, somebody do the research.
Somebody do it. Yeah, somebody do it. Somebody needs to do it. Unfortunately, who that is going to be is kind of like one of the challenges, really. But I found, I mean, when we did our ethos study of person-centered counselling in schools, which we just published recently, I mean, the head of IAP came up to me actually when I presented it at a conference, I think PACP Research, the Division of Counselling Psychology. He was incredibly positive about it. You know, he didn't come up to me and say, oh, person-centered, that's rubbish. He was really pleased to see that an intervention like that was being trialed and tested. And I think if you can test person-centered therapy, you can certainly test pluralistic therapy. And you can do qualitative research at the same time and look at, you know, what people value in it and what they don't value in it, how it's helpful. You can look at how to improve it. I think there's a phenomenal amount of that research can be done. And I think IAP would be really open to that. The reason that there aren't integrative therapies in IAP, as far as I can see, is because no one has yet shown at the level that they require that they work.
Yeah, and just to clarify, because there's a few questions about IAP. I think I kind of assumed that people knew it, and of course they wouldn't necessarily know it unless they're familiar with it. IAPT has been around for a good few years now, and is a mechanism by which psychological therapies is kind of embedded in the UK National Health Service, although it's not delivered across all the 4 nations in the UK. And you know, its advocates would argue very strongly that it's profoundly increased access to psychological therapies, and in that sense has made a significant difference, whereas its critics would say that it's delivered a very particular type of therapy and kind of hasn't been as open as it might be actually to client preference and client choice, and the fact that people need different things at different times. And as always in therapy, the arguments are very heated. So you know, it's a very contentious thing. I'm aware of the time. Before we started, I'll come back to you, Mick. Before we started, I did promise Mick that if the panel were really interesting, that we would go past 5:30. And you know, I've decided that we will go past just 5:30 just a bit, because this is really interesting. And by all means, go and get yourself a cup of tea or a glass of wine or whatever it is and join in. We'll probably take it another 10 minutes and then we'll bring it to a close. Just to say that you know, I don't want to cut the conversation off too early, and we've got the time, but likewise we will stop by kind of 1:45 at the latest. Mick, you were going to say something? Yeah,
I was just going to say about preferences in IAP, because I think that it has been limited. You're right, Andrew. It has been limited in how much it's enacted preferences. But I think that's partly because they don't know. Again, I think my sense of working there was an enormous commitment to working preference. I mean, in children and young people's IAP, the level of service user involvement was fantastic. It was brilliant. You know, they were so open to hearing the voices at a very sophisticated level of young service users, and absolutely committed to that. I think the issue with preferences is that often they don't know what to do with it. Like, how, you know, what do you do? Do you ask a client, do they want CBT or counselling for depression? How do you do that? What's the kind of standardized ways of doing that? I think if there's not a standardized way of doing that that's kind of been shown to be helpful in some way, then they are more cautious. But again, if there was research coming out of the pluralistic field that was showing, well, look, this is an effective, helpful way of working out what's going to be most helpful for someone, including their preferences, I think IAP would be very open to that.
Can I jump in here as well? Just, I mean, a few years back when I was involved in some part of the sight loss sector, we talked to somebody from NICE who was doing the guidelines, and they were indicating that the future direction of travel would be to honour testimony from client perspective. That was coming as, so I would say yes, definitely do as Mick was saying, but in the interim, if you don't have these skills to run an RCT, then anything that gets the client voice is going to be compelling evidence. And again, if you come tomorrow to the pluralistic research, we're going to talk a little bit about that. So yeah, just hooking you in, Andy. That's all I want to say.
Such a tease, Maury. Did anybody else on the panel want to add anything at this point? Okay, Simon asked a question just in passing. Oh, are we allowed to drink wine here? And I think I need to say to you, Simon, that you know, this is a pluralistic conference. You can drink what you want. Obviously, it's got to be a nice approved alcoholic beverage rather than. So we might need to check the guidelines on that. But by all means, help yourself. I'm going to ask one question of the panel, and if there are any other questions before we finish that you want us to cover, please put them in the chat or put your hand up. But I just wanted to ask each of the panel, because you know, part of this is about a collaborative revolution, part of this is about where do we go from here. And Mick, I think, raised a really interesting point, which is we have been brave and we have been kind of trying to work with the potential. But actually maybe not enough, you know, maybe we need to be doing more. And I'm thinking of what Maria was saying, and you know, how are we speaking to people that we haven't previously spoken to and we should have been speaking to? And that analogy of, you know, in 10 years' time, will we have simply redecorated the house, but it'll be the same house. We might have put an extension on and done the garden, but you know, it's the same house. So how do we really use what we've got here, which isn't an approach, it isn't a model. I like Mick's word of kind of framework, this way of approaching something. How do we really shake things here and begin to do things differently? Because the world has changed, and whilst there may be some political positions that are wanting to go back to as it was, it won't go back to as it was, and this is a real opportunity, perhaps. So I mean, any of the panel who want to come in, and by all means, anybody else who wants something to say on that. But I think there's a really interesting challenge about, yeah, we've been brave, but perhaps we're not brave enough. Maybe as we go forward, we need to be really pushing things much more than we have been doing.
I know it's unlike me to be revolutionary, but I think there's an element of actually incited revolutionary from my hospital bed here. I think there's a big thing that diversity has become a real buzzword throughout the profession in the past couple of years, and often people forget that disability is also in diversity. There are a huge mass of minorities, and obviously I'm disabled, I'm Asian, I speak from certain minorities, but there are many other minorities that also have to be included. I think, as previously has been raised, that often people are interested in diversity will come to events such as this, will come to diversity sessions. It's the people that don't come to these sessions that need to be invited and challenged and have an open space in which we can look at elements in a safe space. Because reflecting on what Mick said earlier, we need to allow all these different minorities and different people to be able to come into a space. I think the fundamental problem is that not all of these spaces are always safe. And it should be a space where we can look at our differences and how they relate to each other, as opposed to having to define the people that we are. And I think that's really important moving forward.
Mm.
I'm also thinking about somewhat a different definition of revolution, and picking up on what Rolf said earlier. What I was struck by is that the book idea, how Rolf challenges the system in everyday situation in the session. And I would say there is something about structural changes and what we're doing now, and perhaps in this conference, hopefully, the changes that will come out of the dialogue, but also the choices that we're making daily within our practice, whether it's working within particular discourses, particular political structures, and challenging those. So something about that commitment to this framework, to this approach, and finding a way, but also being a bit of an advocate.
Yeah, I think certainly my own view has been, and I think others have been arguing this for a long time, that there are insufficient politics in therapy as we teach it and practice it, and therapy is inevitably, certainly in my own view, a political activity, and advocacy, which you just spoke of, Maria, is not always talked about in counselling programs. And I think, you know, if nothing else, we should be advocates for the things that we experience in our work. That's a personal view. So you know, by all means, people disagree with that, but it really struck me what you were saying there, Maria. Other thoughts from the panel? Mick?
Yeah, I mean, I go back to Carl Rogers' term about the quiet revolutionary, and you know, I love that idea that revolutionary doesn't have to be loud and confrontational. And I think that for me, there is something we need to do in pluralism, but I think it, you know, if it's loud and if it's critical and if it's attacking people, then it's not going to help. And I think the challenge is to find a way of talking that keeps reminding people of the complexities, that keeps reminding people that there isn't a right and a wrong, that keeps trying to be inclusive and bringing in different voices, that holds that complexity. You know, I think pluralism, I mean, I guess in psychodynamic terms, you talk about the depressive position. And in the same way that I kind of think pluralism is a person-centered view of therapy as a whole, you could also say it's a kind of psychodynamic view, which really tries to move away from that splitting towards one which can hold the good and the bad, and see. And I think that if we can hold that position, and if there's enough of us constantly holding that position and being able to hold complexity, being able to challenge demonization, blaming, prejudice, discrimination, then I think that has a very powerful effect. When I was a student, I studied social psychology. And one of the theories that I liked the most was by somebody called Sergi Moscovici, a French Marxist, about minority influence. And a lot of the psychological social psychology is all about Ash, if you know, and conformity and how people conform. But he was interested in how minorities have an influence. He was particularly interested in the work of Freud and Marxist perspectives. And one of the things he talked about was, and in his research showed that the most important thing was consistency. And there was something about consistently presenting a different position that people couldn't rubbish, or they would try and rubbish it, but effectively if you held it and you held that position consistently, then eventually it would kind of change. You can change a majority. Minorities can change a majority, sorry, if they're consistent and they are committed to that position. And I think pluralism can do that. And I think we have done that. You know, I think we've seen shifts over the last 10 years, for instance, in BACP, away from the idea that there is one right approach towards much greater recognition of different positions. I think we've seen that in IAP, we've seen that in government circles, we've seen that in a kind of policy and the move towards shared decision making. Obviously, the pluralistic community is only one very small part of that, but I think there are enough voices consistently saying about the need to hear service user voices, the need to integrate, the need to see things from a range of perspectives. And I think that's the kind of revolution that we can be part of.
Sorry, Murray, just one quick thing, just a very quick pushback on that, Mick. There was a comment in the chat, and it's important to say the person was also agreeing with what you said, but that they wrote something that I thought was very poignant. And they wrote, but then it can also be very tiring to be the kind, patient, marginalized person. And you know, so what you were saying really struck a chord with me about the kind of quiet revolutionary, and we can do a lot of change without, you know, without being loud, objectionable, and difficult. But there's that opposing view that actually sometimes, maybe in some way we need to find our way of shouting to make a difference. But I don't know.
Yeah.
I just thought, I mean, they were also agreeing with what you were saying. I'm not wanting to.
No, that's such an important point, and I think there's first thing there is that you know, standing up for minority viewpoints shouldn't just be the responsibility of the minorities. You know, that's a responsibility that we all have. And yeah, and it absolutely, it can get tiring. And it can be tiring being that patient, consistent, empathic voice and empathizing with the other position that maybe is against us. And I think sometimes shouting can be very helpful, but I think when that shouting becomes demonizing and blaming and attacking, then I just, you know, my experience, Andrew, is that it just doesn't help. It doesn't work. And I think what works is, I think you can be very loud and you can be very, very forceful, but in a very compassionate, understanding way. And for me, pluralism, what is pluralism? For me, pluralism is about holding open that space for difference. That's really how I see it. I see it as that kind of us as kind of reminding and keeping open that space in the field somewhere that the difference can be allowed to flourish. And sometimes you have to work really bloody hard to do that, and you have to be very strong in holding open that space for difference. But I think that never means silencing any one position. Sometimes you have to push back on it really hard, because when you've got positions that are trying to silence other positions, you have to push back. But it's also about embracing and acknowledging and valuing those the people behind those positions. And of course that's very Rogerian, but it's not just there in Rogers, you know, it's there in nonviolent communication, it's there in human needs theory, it's there in conflict resolution. The work that I'm doing at the moment is trying to bring these different frameworks together, and it's amazing the commonalities. And when you get down to what it means to really facilitate and support change, everybody is saying something very, very similar, which is around holding open that space for difference, recognizing, respecting, but also being willing to push back when it needs it.
Brilliant. Thank you, Mick. Thank you. Mari, I interrupted you.
Yeah, I just wanted to say, like, there's a phrase which is the death by 1,000 cuts, right? Which is really, you know, we can understand all the small actions that can bring about terrible negative things. But if you flip that, by the same token, there's a kind of transformation by 1,000 actions. You know, like, it's like we're all part of it. It's every small thing will move us forward. And I really think that we need to start thinking as a unity, but with difference. You know, we respect and hold our differences, but we have to get our profession. Like, we have to get our act together, you know. And I do think, you know, that pluralism is a wonderful mechanism to hold and to value all of these approaches. But we're gonna do ourselves a disservice if we keep on being such a divided profession. We need to get our act together. That's my thought.
Thank you, Mari, for that. Anna, I'm going to give you the last word here.
Thank you, everybody. I think what you're trying to do, Andrew, with the pluralistic steering group, which is to open it out and to really embrace outreach, and to look at collaboration. So we had this discussion at the steering group a while ago about how do we start to have a dialogue with a pluralistic dialogue outside of counselling, so that we don't become an echo chamber. I think is really important. So that's the first point I want to make, that I really agree with that. And I think that's really important, is that we need to start thinking how we do that. And then for me, it goes back to our students and our trainees again, and how we as academicians and as practitioners at one end are then engaging in that wider discussion with new practitioners, and encouraging them to also be part of that, so that we're having we're keeping that dialogue open amongst ourselves and amongst the community and all levels of the community. But then through that dialogue, helping each other to understand, well, how can we then open that out more politically, more ethically, more socially aware, to other organisations, other fields of practice like mental health, medical model, and all the rest of it that we talked about.
Yeah, thank you, Anna. Brilliant. So I'm going to do two things now. The first thing I'm going to do is thank everybody. So I'm going to thank all the panel for being prepared to kind of step up and put your thoughts out there and kind of hear the challenge and the agreement and the disagreement. And I think there's been some really fantastic things there. And also thank everyone who's participated, people who've asked questions, and the chat's been bouncing, if a chat bounces. It does now. It's been a really good chat, some really good stuff in there. So thank you everybody for kind of getting involved in this and making it a really interesting discussion. And it feels like the conference is well underway. The second thing I'm going to do is say we're going to finish this formal panel now. And for those of you who were here when the conference started at 5, you'll be very excited to learn that there's more of that. But some people might bring an alcoholic drink. It's not compulsory, but some people might an alcoholic drink, which makes it even more entertaining and even more funny. It does say on the programme 7 till late. Please do not be alarmed. That does not mean you have to stay here all evening, but you would be very welcome to hang around in this virtual space. You know, give yourself a little break from the screen. Come back. John is going to keep the link open. If you're not able to stay, absolutely fine. We start again tomorrow. If you join at 9, you can have another half hour of hanging around with small talk at 9 tomorrow as well, which I'll be there because, you know, I'm learning a lot about small talk, as you can see now. But come along. Just, I mean, last year's conference we tried this kind of virtual pub type space, and we had nearly 200 people on it, and it was great. So please hang around. But if you can't, absolutely not a problem at all, and we'll see those of you who can't stay 9 to 9:30 tomorrow for the full conference. So thank you all again. Been a really great evening, and see you all very shortly if you can stay.
Thanks, Andrew. Andrew, can I suggest that maybe if people want to stay, we will take a 10-minute break, and
yeah, good idea. Yeah,
and then we'll come back for 7.
Yeah, good idea, Mick. So we're back at 7.
And if you want to stay, leave the connection running, but you might want to turn your camera and mute. And thanks so much, Andrew, for fantastic sharing.
Thanks, Andrew.
Thank you.
Wonderful job.
Thank you all. See you all shortly.